Hi, I'm Dr. Suzanne Lester, Assistant Professor of Family Medicine and Site Clerkship Director for Family Medicine at the GRU UGA Medical Partnership in Athens, Georgia. And I'm here today to talk to you about the struggling medical student. So you may ask, why do we care? Well, the reason we care is that we do know that many medical students struggle, and we really don't want them to proceed through the next stages of their training without identification, remediation, and improvement on those inadequacies. There was a journal article in the Journal of Academic Medicine in 2008 that looked at a national survey response that stated that 10 to 15% of medical students were identified as struggling. Educators, however, believe that there were many more struggling students who were not identified, and part of the lack of identification came in that written evaluations often didn't reflect poor performance. They also noted that policies and procedures in this area vary widely across institutions. So again, our hope is that through early identification and remediation will help to ensure that struggling students do not move forward with inadequacies. So before we move on to tips for identifying the struggling student, we first want to speak about preventing the problem if possible. So first thing that we would want to recommend is that you know the clerkship office expectations of students and faculty. Make sure to state those students and your own expectations based on your clinical experience and your practice setup. Communicate those to students at the beginning of every rotation. Examples are what your version of professional dress might be, what time you expect the student to arrive, what their work hours are going to be like, what your expectations are in terms of their caseload, study time, etc. Make sure that after explaining those to the student that you have them reiterate what they just heard. Finally, it's good to know what are the procedures for the institution and resources for handling difficulties with students so that you're not delayed in addressing those issues, because we do know that you will be providing timely and specific feedback to students. So now on to identifying the struggling student. First of all, you need to be able to recognize troubling behaviors and attitudes that represent an underlying student issue. Examples of those behaviors are difficulty in building rapport with team, with patients, or with you as the preceptor, not upholding professional standards for appearance, not being dressed appropriately, for timeliness, being late all the time or frequently, and often overly casual speech may be an indication that the student is having an issue. Other students may show disinterest, they may seem to be disengaged, they may actually seem disrespectful. Also, the inability to demonstrate an expected fund of medical knowledge may indicate an underlying problem that isn't a learning problem, that may be a mood problem or something else. So we want to make sure that you recognize these behaviors and you're confident that you're recognizing those, and you enlist your staff to help assess if those behaviors are happening across the board in your practice with that student. Also of note, for severe or abusive behaviors, stop the student immediately, pull them out of the clinical situation, and contact the clerkship office immediately. So now that you've identified some worrying behaviors that may indicate a struggling student, you might want to look at the different categories for those types of problems. So is it an affective problem, a cognitive problem, a structural problem, or an interpersonal problem? Examples of affective problems or affective problems are depression, anxiety, other mood disorders, substance abuse, adjustment disorders, stresses. So many students in transitioning to their clinical years may feel isolated and overwhelmed, while others just find it great to finally be out from under the books and interacting with real patients. For others, it may be that they have difficulty in translating their style of learning to the clinical environment. This would be a learning difficulty. For others, this may be the first time that a true learning disability manifests. Structural issues have to do with organizational difficulties such as time management, prioritization of tasks, prioritization of material, and ability to multitask in the clinical environment. Interpersonal problems really relate back to interactive difficulty, or maybe exemplified by interactive difficulties, where the student has difficulty interacting with patients, staff, colleagues, or even you as the preceptor. And this may indicate an underlying personality quirk, like they're very shy or they're socially awkward, but there may be some other more profound problem in terms of how they relate to others. So before you make your final assessment of the student, hopefully no later than by the mid-rotation, you do want to check in with the staff and make sure that it's not just you that's seeing these things. In our next slide, we'll talk about how to discuss the problem with the student. So now that you have a sense of the behaviors that your struggling student may have exhibited, and you think you may also know what category their problem lies in, the next thing you want to do is to identify the problem with the student. Ideally, you'll do this immediately after you witness a behavior that you're concerned about, but do it in the correct setting. The correct setting means ideally not in front of patients and not in front of a group of staff. However, you may want to have at least one staff member present as a witness and to validate your concerns and possibly the student's concerns. Also make sure you allow adequate time for discussion. Please don't do it in the middle of patient care time unless you know you can block out up to 15 minutes to discuss with the student the issues you've had. Because you never know when you start probing with the student what's going on, that this may be something there's a deeper underlying issue that might take more time to resolve. I like to start my conversations with students when I'm probably going to be giving negative feedback by saying, I think we have a problem. What do you think is going on? And I try to start out by having the student reflect and give me their sense of the issue. If they don't have that insight, then it can be a more awkward conversation, but we need to proceed nonetheless. And a way to proceed sensitively is to address expected behaviors specifically and avoid addressing the student's personality. Even though we all know there are students with personality problems, the main thing is to try to address behaviors because we typically can't fix a personality, but we may be able to improve behaviors such that that personality is no longer a problem. So you and your student have had a nice, meaningful discussion about their behaviors and your expectations of their behaviors, and they've helped to self-reflect and provide you with some insight into why they're acting the way they're acting right now. So the next step is between the two of you and possibly a key staff member is to come up with an intervention that will help change behaviors. So with this, you want to make sure to set very specific goals with student input. You want to make sure to provide resources for the student. And if you don't have the resources on hand, then feel free to contact the clerkship office and we'll help assist you. You also want to make sure to set a time frame for behavior change, i.e., this is what you're doing wrong, you're in agreement, the student is in agreement, and here are the things that I would like for you to do to correct that behavior, and I expect to see change by when. So you want to be very clear in that, letting the student know when you're going to be re-evaluating their behaviors. You also want to make sure to be very clear on the next if-then statements, such as, if I don't see improvement within the next week, I'm going to need to call the clerkship director and come up with a plan for you. Okay, so those are the things that you want to make sure that you cover when you're identifying an intervention. And ideally, this is something that you and the student plan together. So you and the student have identified the problem and have a plan for remediating the behavior. So now you're going to implement your intervention and you're going to monitor student progress. It's really important, again, keep involving the key staff who will have eyes on the student more often than you will, which is often the case. You want to make sure to give timely feedback. So if you see improvement, let the student know right away, even if it's just briefly passing the hallway saying, great job. And make sure, again, to give concrete feedback regarding specific behaviors, specific behavior change, and any remaining specific issues. Make sure, again, to involve the clerkship office if you don't see improvement or if you see a behavior that's particularly worrisome. And again, make sure to use outside resources as needed. So the final step in dealing with your struggling student is evaluation. So you want to make sure that all along the way you've been giving very specific feedback to the student. And remember that when you're giving verbal feedback, many students don't recognize it as feedback. So we recommend that you bookend your feedback with the words, I am now giving you feedback, and did you understand the feedback? So that way it's harder for a student to not understand that you just gave them feedback. In terms of your written evaluations, again, the mid-rotation feedback form is required at the midpoint of the rotation, whether it's a 2-week, a 4-week, a 6-week, or an 8-week block. The point of this form is to make sure that struggling students don't slip by the entire rotation without an opportunity for change. So when you use that form, the most meaningful way to do it is to be very honest, to discuss behaviors, and to have recommendations for behavior change when you meet with the student. And you're supposed to meet together, go through the form together, and both sign it. For your final evaluation, hopefully you'll be able to reflect on where they were at the midpoint and how they've progressed since then. If they haven't progressed at all, please try to give the student a warning of an impending marginal or failing mark, and as well let the clerkship office know if you think the student may be marginal or may not pass. But if they have shown improvement, it's important to note that on their final evaluation form and to make sure to be as straightforward in describing their behaviors as you saw them throughout the rotation. If you have any questions regarding this topic, please make sure to contact the clerkship office at the GRU UGA Medical Partnership in Athens, Georgia. Thank you.